Good afternoon. This is Monica DeRoussel with the Monica DeRoussel Show, and today it's my honor and privilege to have Dr. Rodway with us in Beacon discussing his story. Let's dive right in.
Thanks for having me.
How did your story started?
Well, Beacon Orthopedics, our orthopedic private practice group, is centered here in the greater Cincinnati area, and I'm a Cincinnati boy. Grew up in the Mason area, in the northern part of Cincinnati, up by Kings Island, which is an amusement park a lot of people in the Midwest are familiar with. I grew up in Mason, went to Mason public schools, and a public school kid. Did well through my public school experience and went on to the University of Cincinnati, where I was a chemistry major. I was always interested in science and always had an interest in medicine, and as I continued through school and through my training, I continued to do well enough to continue to the next level. Eventually went to UC Medical School.
Nice.
And then on to residency.
Where did you do your residency?
I chose the field of orthopedics. To me, orthopedics is very satisfying in that people have problems that you can fix, that you can get them back on their way and doing the things they want to do. I trained for orthopedics in Toledo, Ohio, at the University of Toledo. Several of my partners here at Beacon Orthopedics also train there, so it's kind of a small world to be back together with those guys.
And you have a very specific niche in what you specialize.
Yeah, so my specialty is spinal surgery, mostly surgery of the neck and back, and I did my fellowship for spinal surgery training in Boston. After finishing my training in Boston, I came back to the Cincinnati area and joined Beacon Orthopedics.
We're honored to have you here in our local market. So did you always know you wanted to be a doctor?
As a child, I always had interest in medicine. My father was an engineer, and so that interest in science and practical applications kind of carried me through into an interest in medicine. And again, the practical applications of orthopedics where you have fixable problems that you can, get people back on their feet.
If you can pinpoint one person in your life that kind of steer you in the way and direction, who would that be?
I mean, certainly my parents were a big inspiration growing up. And then moving through undergrad and medical training, there were certain people that kind of helped you along. When I was a resident, the spinal surgeon I worked with in Toledo, Dr. Ashok Biani, a great guy, and he inspired me to pursue spinal surgery.
People always think, when we feature our guests who made it happen, it always came easy to you. Is that the case?
Not everything comes easy. Certainly math and sciences were relatively easy for me.
That's a blessing for a lot of people.
But just continue to work and have that interest in learning and to continue to advance as you go.
A lot of times people quit. Which advice or what does it take to be successful?
Persistence, to keep working toward your goals and set reasonable goals and work toward them. And as you see those little wins come along, it gives you the wind in your sails to keep going. So
what does the life of Dr. Rodway looks like today?
So my practice is mostly, as I said, neck and back surgery. I do mostly adult degenerative. We also do some scoliosis surgery and other things. We take care of mostly adults here.
Okay.
And then I also do some work with the Cincinnati Reds. I've been under our senior partner, Tim Kremchek, who's been their doctor for 24 years. I've been helping him from the spine side for the last 12 seasons.
So you devote your time between Reds and patients at Beacon?
That's right. It's mostly adult degenerative cases, kind of the wear and tear, the arthritis, the disc herniations, pain in arms and legs that you get from pinched nerves. That's kind of the bread and butter.
So do you do surgeries every day? What does your daily life look like?
So typically surgery 2 to 3 days a week and clinic 2 to 3 days a week, depending on the week. That's the usual routine.
And why Beacon? Let's talk about Beacon.
Well, when I first came, I knew I wanted to come back to the Cincinnati area, and I had interviewed with several groups in town, but the idea of Beacon being a multi-specialty orthopedic group that also has non-operative doctors as well. We were able to handle everything from the beginning to the end, whether you need just physical therapy or injections to surgery and multiple different kinds of surgery. So it was the obvious place to work when I was looking for a place to land.
If there is a motivational quote that gets you inspired every day, can you think of anything that we can mention to our listeners?
Something that inspires you every day? No rest for the wicked, I would say. You just got to keep working.
That's a good one.
So you can't rest on your laurels. It's, every day is a new day and a new challenge.
So as you reflect on your successful story of making it happen, which advice would you give to our listeners? Looking forward to the future, what you learned over the past, and looking forward, where are we going?
Well, I'll tell you that, I had a major life event in the past year. About 7 months ago, I was diagnosed with cancer, and that in and of itself was a whole new awakening, a whole new struggle and a whole new fight. And luckily, with great doctors and, lots of prayer and good luck, I've so far so good come out the other side. So that's given me a whole new viewpoint.
Perspective on life.
Yes.
It's probably 90% of success is in your attitude of making it happen and not taking no for an answer,
Yeah.
Looking at the challenge and going straight for it.
Yes.
As we think about ups and downs in your life, if there's experience that you can think of, looking back saying, I wish I did it differently, is there any case like that?
No, for the most part, I'm happy to say that I've been happy with the way things have turned out. My route was probably pretty boring, but I knew kind of what I wanted to do, and I worked through the steps to get there. So, aside from this cancer setback, everything else has been, pretty linear.
Well, hard work, positive attitude, loyalty. You've been with Beacon for 12 years, since 2008.
No, our group has been very steady, it's always been a real family. And when I got sick recently, they couldn't have been better, from my partners stepping in to take care of my patients, the seamless transition with my staff and, physician's assistants stepping in to make sure the patients didn't miss a beat, and the administration has been wonderful, and I couldn't have been in a better place.
What a blessing to have family-run business like Beacon taking care of its own people, right? Yep. So are you back fully practicing again?
Yes, very soon. So plan to be back here soon and back on to the work.
I bet everybody's going to be so excited to have you back on the floor and doing what you best at.
Yep, looking forward to getting back at it.
Well, thanks again for being with us today. Thank you for sharing your inspirational story of making it happen.
Thank you.